Hello, my name is Barbara Goss and I'm the Mental Health Delivery Manager for the South East, and I'm here with my colleague Karol, and I'll let him introduce himself.
Thanks, Barbara. So my name is Karol Kuczera. I'm the interim head of staff experience and well-being, as well as the Equality, Diversity and Inclusion Program Manager. I work for NHS England and NHS Improvement across the South East.
Thank you. So together, Karol and a number of our colleagues have been working on a range of activities to raise awareness and support NHS and social care staff with their mental health and wellbeing, as poor mental health of staff has been a significant issue pre and post COVID. And today we're going to really sort of focus on men's mental health and men's mental health amongst ethnic minorities. So today we are so happy to have with us GP, mental health advocate, TED talker, Dr. Mohammed Khaki, to help us continue our conversation on this topic. So welcome, Mohammed.
Thank you so much. I'm really pleased that we are talking about this today. It's something I'm so passionate about, and I think it's really great that we are championing this cause and looking into it today. So I'm really excited to talk about it.
Thank you so much. Thanks for joining us. So I just want to just have a little, just start off with understanding a bit about your journey from sort of general practice to mental health advocate and one of the leading voices on men's mental health. I mean, you've contributed to mental health magazines and a number of different organisations. So how's that journey been from one thing to the other? Or
well, I think in a time pre-COVID, 1 in 2 consultations I had in my surgery were about mental health. But the new landscape has meant that almost all consultations, we touch on it to some extent. But the challenge has been that mostly it's women who are open to discussing it. Men, particularly minority ethnic men, are still so hesitant to talk about their mental health. And of course, it's a really worrying trend if we consider that the leading cause of death in men under 50s is suicide. Now, men, anyway, of all backgrounds, on average, are 1/3 less likely to seek medical help than women. And of course, ethnic minority men or men in marginalized communities, even less so. So of course, with so many in denial about those health issues, it was something that really resonated with me. It was something I saw in practice, and it was something that I felt we needed to champion, we needed to take out and actually focus on and get more men engaging with their mental health.
That's great, Mo, because I was thinking that some men, as you said, may be very hesitant to talk about their mental health. And unfortunately, there is still quite a lot of stigma attached to it. Yeah. So I was wondering, what sort of message should men hear about talking about their mental health?
Well, I think one of the key things to remember is the brain is just like any other organ in the body. It needs help, it needs support, and it's so important that we remember that. I think one of the best examples I give in this regard is if I were to ask you to carry a heavy glass of water, and I said to you, well, how long could you carry it for? You'd probably say 1 or 2 minutes. Your arm would suddenly start to ache, and then you'd want to put it down. The brain is similar to the physical side. It's just that instead of putting down that mental stress, we carry it, and that aches and it causes pain, it causes hurt. And I think for many of us, we forget that. We think, sorry, my button is gone. For many of us, we forget that. We think that mental health is different to physical health, that it's something that we should be worried about, that we should be ashamed of discussing. And actually, it's nothing like that at all. For so long, men have had this concept of traditional masculinity. I'm a male, I need to provide, I need to be strong, I need to be impenetrable, I can't have any worries or concerns, I can't be seen to be getting help. That's a huge, huge misunderstanding. We all need support, all of us, even at this very moment in time, we're all suffering with some form of mental illness, some feeling of unwellness, but it's a scale. some of us are just a little bit irritated. You know, we got cut up in traffic, or the internet wasn't working, and it's something we have to get over. But sometimes it can be stronger. And on that scale, when it's really affecting our functioning, when it's causing us to feel low, when it's affecting our mood, it's affecting our relationships in our life, that's what we want to talk about. That's what we want to say, come in, and we can help you and we can support you.
Great. So could you talk us through a scenario perhaps where somebody came to your practice and the signs of mental health difficulties weren't perhaps immediately obvious, and what helped you to identify that struggle?
Yeah, I mean, it was a gentleman who came in once, and he said to me, you know, Dr. Khaki, I think I've got some niggling aches here or there. I said, okay, and we examined him and couldn't quite find anything. And then we talked about a plan and sent him home. And a few weeks later, or a few days later, in fact, he called me. So, you know, I think this is going on. I think that's going on. And after a few weeks of this, I recognized that a lot of those aches or pains or little concerns didn't really make sense. They weren't in part of any medical cluster. They weren't something that I could put my finger on. And I thought, maybe this is his way of reaching out. Maybe this was his way of saying, I'm not well, I'm struggling, but I can't say that I'm mentally struggling. So what I'm going to do is I'm going to say I'm physically hurting. I'm going to say that I have an ache somewhere. I'm going to have these odd symptoms that I can't explain, because that's my way of telling you I'm not coping at the moment. And as soon as I said to him, and it was an older gentleman, Asian male, I said to him, you know, for this instance, we'll call him Mr. Khan. I said to him, Mr. Khan, you know, is it possible that you're not feeling that well at home? You're not that happy in yourself at the moment? And he paused and he looked at me and he said, do you know what, Dr. Khaki? That's exactly what's going on. I'm finding it really hard to cope. I'm finding it really hard to spend time at home and be happy. I miss someone who passed away. I miss my family. I have these terrible thoughts. And we started talking about it, and suddenly it was like a whole burden had been lifted off his shoulders. I've never seen someone who seemed so happy to talk about their mental health despite previously holding it in for so long. And I think that's the effect that this can happen. I think when we start talking about what's really on our mind and what's really going on, that feeling of being able to talk and unburden ourselves is so liberating. And I think that's something we want to talk about today.
Great. And I guess you already touched on it a little bit, but I wanted to unpick it a little bit more. And we know that research shows us that men from underrepresented groups such as BAME, LGBTQ+, or people with disabilities may experience much higher rates of mental health difficulties than the general population. So why do you think that may be the case?
Well, we know that if you're in those populations, you have lots of concerns about the health and mental health system. You may have worries that pre-exist. Again, we talked about traditional masculinity and concerns about how you're viewed in your communities. But also, there's the worry about confidentiality. There's the worry that the information I'm going to have is going to be shared somehow, which it isn't unless it's something really, really threatening to somebody else's life. There is the worry that I'm going to be discriminated against, that somehow the system is going to not trust me because I'm from a marginalized community. And of course, there are other things like feeling that the faith community or community I belong to won't accept me, that I'm not going to be part of that community. And actually, what we see is that because of these worries, people from the marginalized communities or people within these communities would say, you know what, I'm not going to come forward. I'm not going to speak up. I'd rather keep it to myself. But actually what I want to say, and this is a really important message, is when you come to speak to your doctor, when you come to fill in that form or speak to any healthcare professional, we have a duty of care to you and you alone. We're here to listen to you confidentially with no judgment and to listen to what you've been through and what you're going through right now. Our job is only to help you get through this. It's one of the reasons we love being in healthcare, because our job is only to try and support you through the suffering you're having. So if it is mental health and it's something that you've been struggling with and you're worried about all these manner of things, let me tell you, none of them come into our thinking. What comes into our thinking is how can I help this person get through this period of time?
Yeah, great. And I guess thinking about the wider context of the different influences of why our mental health may be suffering, I think it's fair to say that COVID has had an impact on our mental health, full stop. There was a study that was recently published by Lancet Psychiatry that suggested that 1 in 3 people who were severely unwell with coronavirus, when then diagnosed with a neurological or psychiatric condition within 6 months of infection.
Yeah.
So are there any special considerations we need to give to long COVID or recovery from COVID and the impact of that on our mental health?
Well, absolutely. I mean, I'll talk about 2 aspects. We've got COVID-19 itself has been unbelievably stressful. I mean, we all know that, but I think as a healthcare professional who is seeing it day in, day out, the emotional toll of struggling with seeing sickness in your family, potentially yourself, seeing loved ones, friends who have been unwell, the physical element of the stresses, if you're working in the healthcare profession particularly, but also all of the other challenges. We know that the mental intellectual challenge, if you're somebody who's working in the hospitals or in the community and having to get to grips with all the new stuff going on and all the new guidelines and all the new information, but also if you're at home and you're listening to announcements and you're trying to work out what to do, all of that has been so difficult. One of the hardest things we've had to deal with is uncertainty. And the truth is we don't know. We don't know what the future is going to hold. So all of that has added such a mental health burden to us. And every single person I speak to is suffering more than they've ever suffered. Now, when you add in, if you've had COVID-19 and you've developed shortness of breath or unwellness or generalized tiredness, or of course the impact on your mood, because we know that all of that has a huge impact anyway. We know that illnesses, significant illnesses, can affect our mood, make us feel lower, make us feel more tired, make us feel less able to cope with things. And now we're seeing that actually there's a crossover. There's a crossover between the impact of a long-term illness, which always affects our mental health, the fact that we are still living in a pandemic and there's so much uncertainty, the fact that we're still coping with all these new conditions of challenges of our job and our career and our children and the ones we loved, and trying to keep all of that in and be strong and say, well, I'm not going to let them know how affected I am. And actually, all of that is causing us, especially if you have had COVID and you've developed long COVID, to have long-term mental health illness and feeling unwell. And I think if you're somebody who's hearing this and saying, wow, do you know, my mood has been a bit more off. I've been feeling a bit more irritable. You know, my sleep hasn't been right for a few months. I don't have the energy or enjoyment in things I used to. These are signs, subtle signs, that your mental health is not what it once was. And actually, that's when we want you to come forward and say, look, we're here to support you through this.
Mm. And it's really great that you are talking about it. And I'm thinking also about the sort of very worrying and alarming suicide rates in men. And the Office for National Statistics said that the deaths by suicide in men account for about 3% of that. So could you say a little bit about when do we need to be concerned, what to look out for, and how to talk to somebody who may be, you know, experiencing some suicidal ideation?
Yeah, absolutely. I mean, I think this is one of the key elements of all of this, which is we know the #1 cause of death in men under 50 is suicide. And I think when you think about that, you pause. That is unbelievable. How can it be that the #1 cause of death is something so preventable like mental health? And I think when we think about that, it shows that all of us have a duty here. So I think the first thing we have to remember is, if you're somebody who yourself are worried about your mental health, you're a male, you're saying, you know, I don't quite think I'm doing okay. The first thing I would say is there's never a point when you're too late or too early to seek help. If you say, do you know, I'm not quite sure, maybe I'm just a bit more anxious than normal, come and speak to us. But if you're saying, you know, I feel really bad, I think I'm at the end, I can't do anything, still reach out. because we're here to support you. And guess what? There are things we can do to help you get through this. Sometimes when you're at your darkest, when it's at your most difficult time, that's actually when we say, do you know what? There's so many things we can do to support you. And we're going to come in and we're going to give you as much support and help as you need. And so that's the first thing I would say. If you're suffering, don't suffer in silence. Come forward. It will be the best thing you ever do, and you will thank yourself later for it. The second thing I would say is, of course, if you're somebody who is worried about somebody else, if you're seeing a friend who's suffering, if you're seeing someone you care about who isn't coping as well, then ask them. Don't worry about keeping it in. Don't worry about trying to pick up the signs and trying to read about it and say, well, I think he could have this, I think it could be that. Sometimes we get so worried about the diagnosis, we forget to say, well, is there a problem in the first place? And I think when we ask each other, there's a lovely thing I always talk about, which is asking twice. You know, when I say to you, how are you doing? You say, you know, I'm great, I'm good, everything's happy. But hold on, is everything really happy? Because we're in the middle of a pandemic here. It's not that great. Well, how are you really? When you say that second question, suddenly people pause and they go, well, yeah, it's been tough, you know, actually, I'm not coping as well as I thought. And suddenly that conversation opens up. One of the things we've talked about, and I know that we're aiming to develop, is safe spaces to talk and listen. And the reason why that's so powerful is once you give somebody the option, the opportunity to speak out and say, you know, I'm actually finding it really tough. I'm finding it really hard. My mood's been lower. Just in that moment, just being there for that one conversation can change them completely. It can give them a space to say, you know, all these things have been going on. And that outlet has proven to be therapeutic in and of itself. It's part of why we have talking therapy. So if you're worried about someone, reach out, give them a call. And actually, when you say to them, do you know what? It's been rubbish for me too. I'm finding it quite tough as well. Suddenly we go, shoot, we're all together in this. I recognize that I'm not alone, because one of the biggest things with mental health is the feeling that I'm the only one suffering, that I'm the only one going through this. But actually, we're all, to some degree, suffering with some mental illness. We all have some challenge going on. And so I would say, don't worry about trying to diagnose it. Don't worry about trying to work out what's going on. Be there, give that space. And of course, there are other things we can do for ourselves aside from that, which I'm happy to talk about if you want to shortly.
Great.
No, we definitely will. But I think, Mo, you've hit on so many important factors. I mean, we are in the middle of COVID, and some of our safety nets have been removed. All that connection with other people is all remote, etc. So, is there anything, I mean, apart from reaching out, but asking that question? But then we always answer the question, how are you? And you get the stock response, I'm fine.
Yeah.
So sometimes with the stigma, some people may be feeling with mental health. How can we sort of break through that a bit more?
Well, I think it's about, now we're moving out of lockdown. In a few days, we're going to be out of lockdown. We're going to have an opportunity to go out and see each other once again. And I think we have been almost conditioned by this lockdown to not see each other, to not spend time with one another, to not be in the other's company. But now is the time to get back and rekindle those bonds. Do the things that you like doing with the people you like doing them with. You know, one of the things that we've seen from COVID has been the fact that we've really recognized what's important. And I think that human connection is so, so important. So if there are friends who you were friends with, who used to do things together, you used to spend time going for sport, you used to go and have a drink together or have a coffee together or have a meal together, get in touch with them, speak to them, give them a call, say, look, we're out of this, let's meet up, let's catch up, let's see how each other's are doing. One of the things we've seen is, of course, we're doing more Zooming, we're doing more Microsoft Teams, we're doing all these different things, but there's nothing like being in the company of one another physically. So I think if you're looking at this and saying, well, it's really tough, I've lost contact with people, I'm not sure if they want to meet up still, let me give you a guarantee. Everybody wants to see each other again. They want to spend time with each other. And if you're feeling that you miss your friends and family, get in touch with them. They are ready to come and meet up. Of course, for men, particularly, we like doing things. We like to be active. We like to be fixing or creating or trying to problem solve. It's part of our nature. And I think if there are things that you have been neglecting, if there's the element of wanting to go to the gym again or getting out and doing some exercise, and you've been worried, you've been concerned, and now the lockdown's lifting, take that opportunity. One of the things we see especially is doing things in community. So when you go to the gym, when you play your sport, when you kick about with friends, suddenly that endorphin level comes up, that happy hormone comes up again. So I think those are really, really powerful. But again, I think, as you said, Barbara, one of the things we do is we say, how are you? And we respond and say, I'm great, I'm fine, and we dismiss it. And I think on that note, I would say, ask again, how are you really? And when you ask the second time, it does penetrate through. It does come through, and people say, you know, this is how I'm really feeling.
So it also, as you were saying, it made me think about when men sometimes may be avoiding talking about certain things for the fear of opening something up and perhaps not knowing quite how to deal with this. And there is a growing body of evidence suggesting that NHS and social care workers may be experiencing higher levels of, for instance, post-traumatic stress disorder.
Yeah.
So how can we get better at recognizing those signs and symptoms of PTSD in men, in particular, where they may be a little bit reticent to talk about this?
Well, I think it's a really good question. And what I would do is I would take the burden off us. I would take the burden of diagnosing, of working out, am I in that PTSD category? Am I someone, or do my friends have it? Because I think often we hear terms like post-traumatic stress disorder, depression, anxiety, bereavement-related issues, and we think, maybe they're going through this. And there's that inquisitive nature, which is completely normal. But actually, I think for us as healthcare professionals, the number one thing we really want to do is we want to see that if you're not okay. And I think the number one thing you can do if you're watching this and you're thinking, well, you know, I wonder if my friend's got PTSD, I wonder if I've got PTSD, I would say, look, don't worry about diagnosing it. That's for the healthcare professionals. Worry about and recognize when something's not quite right. So, for example, in PTSD, often we may have hyper arousal, we may get scared very quickly, we may jump, we may get fearful of things, or we may have nightmares, recurrent scary thoughts. That's just one or two of the symptoms. The fact that we recognize that those are not normal, the fact that we recognize that those are not healthy for us, and actually that we're suffering, is enough. That's enough for us to say, well, look, I need to speak to somebody. And of course, at that point is the time to reach out to your GP and get the help you need. Of course, we have got some fantastic resources around this as well. We've got this resource called Understanding Trauma in Healthcare, and it's a really, really good resource. It's part of our website, you know, looking after our people. It's part of the Southeast Leadership Academy's resources. And I think if you're watching this and you want to go online and look at that resource and look at the information available, that's really helpful as well, to help you as part of that. But I wouldn't worry too much about being the diagnoser, being the expert. Let the healthcare professional do that. Just recognize when something's wrong and get help.
And it very much reminds me of from my clinical background in psychotherapy. There was this sentence that we used quite often, that what we are experiencing is a normal reaction to abnormal circumstances.
Yeah, absolutely.
And I think it really, you know, greatly kind of underlines that, you know,
exactly.
We have to recognize where we are in terms of our coping strategies, but also not kind of going immediately into pathologizing what may be quite a natural and normal reaction to what is going on around us.
Exactly. And actually, one of the things that we see in research, and I have had the opportunity to do international aid work and work with mental health in war zones and areas that are really struggling and with you know, very scary, worrying circumstances. And one of the research points we found was that actually in that instant, when people are suffering, one of the best, most powerful, evidence-based things we can do it's not necessarily go straight to diagnosing what the problem is. It's actually lending an ear. It's actually saying, tell me what you're going through. Tell me how you're feeling. And the evidence from research shows that by giving someone that opportunity to tell you what's happening, tell you about their struggles, tell you about what they've been facing and the symptoms they're having, has one of the strongest, most positive effects on their mental health. So if you are someone struggling, talk to someone about it. And if you think that you know somebody who is in that boat, have a word with them, speak to them, start that conversation.
So this is quite difficult for you to answer, but as an organisation, what could we be doing better to support our staff?
As the NHS, do you mean?
As the NHS, yeah.
Well, I'm of the belief that we work in one of the best healthcare systems around, and I think we have been unbelievably resilient as a workforce. I think I'm never more proud in my life than to tell people that I'm one of an amazing body of NHS people who work and care for so many people with selflessness, with benevolence, and with utter devotion to their health. The cost of all of that dedication is sometimes we go over and beyond. And I think in this pandemic, we have had to do that for the sake of the health of our amazing UK. Now, the reason why I give that preamble is I think a lot of us have been through such challenging circumstances that perhaps we haven't recognized it. You know, we have always been 100% full throttle. I'm going to help a patient. I'm going to help the service. I'm going to do all I can. And we forget and we often neglect our own mental health. And I think personally, what would be good when things are calmer, when we're a bit more in control of the situation, is for all of us to have an enforced mental health assessment. You know, have our managers or have our teams speak to us. A 10-minute or 15-minute conversation just about us, just to say, well, how are you doing? How have you coped? How are you feeling emotionally? How are you doing from a mental side? How are you sleeping? How's your appetite? How's your relationships outside of work? And I think many of us, because we're so stoical, we're so dedicated to the NHS, we're so keen to show that we're always here to support. We'll always try to be strong. We'll always try to prove that, no, we're okay. I think by taking it out of our hands and saying, well, look, we know this has been a tough year. Even if you can't necessarily see that, even if you want to be strong, have this 10, 15-minute time, have this maybe even 20-minute time to just tell us what you're feeling, to talk about it. And I think that will be such an impactful opportunity. And as we said, getting it off the chest and having that opportunity to speak about it and knowing that someone cares about you enough to make that time will be such a powerful initiative. And also, if we are suffering, it will help us to work that out. It will help us to realize that, gosh, I didn't realize I'm not coping that well. Maybe I need some counseling. Maybe I need some medication. Maybe I need some input. So I think that's what I would be advocating when we're in more control of things.
So, Mo, very sadly, quite a lot of people lost their loved ones, and we've also produced some videos on bereavement, which are accessible via our Southeast Leadership Academy website. But the question I have is, do men approach grief differently than women?
Absolutely. I mean, one of the things we see again is that we know that women are more emotive. They are more able to express their emotions, whereas men tend to revert to type. They tend to say, well, I'm the male. I'm going to look after things. I'm going to do the things I need to keep the ship steady. I'm going to do the administrative stuff related to death. I'm going to look after family. I'm going to arrange the funeral. I'm going to make sure everyone else is around. It's part of who we are, part of our DNA to try to support. But actually, what we fail to recognize sometimes is you can't drink from an empty cup. You can't drink, you can't pour from an empty cup even as well. You can't help other people if you're not in a situation to help yourself. And I think when you go through something so powerful, as a death of someone you care about, someone who you love, that's a huge thing that we have to recognize, that we need support too, that we need help too. And I appreciate that there are elements of a partnership here. You know, you may want to take on the lead and help and do the organizational bits, but I think there's an element when we say, now I need that help. Now I can take a step back and say, well, look, I'm also part of this equation. I'm also here. And for me to be functioning and to be supportive long-term, I need to help to cope and to deal with this grief. And I think one thing we always do is we forget the long-term picture. We say, well, you know, I'm fine. I'm fine now, and I'll just keep being fine, and I'll keep putting it off, forgetting that at some point it catches up with you. Just like everything in health, if you don't regularly exercise, if you smoke, if you do whatever, we know that for the first few years you'll be fine maybe, but after a while it catches up on you. And mental health is the same. We can't keep suppressing it. And I think the resources that we've created on the Southeast Leadership Academy, particularly around bereavement and complex grief, because this is complex grief, is a wealth of opportunity. If you've lost someone during this pandemic, if you've lost someone even before the pandemic and you've been holding that loss and that grief down and you've been trying to cope, well, now is the opportunity to say, I can focus on myself. I can use these resources that are free and are accessible to get the help that I need to deal with it. And it's not necessarily saying, gosh, this is a mental health problem. This is an issue that means that I've got a long-term element. These are significant life events that when they impact us, they really do impact us and can affect us for years if we don't cope with it and deal with it early on.
That's brilliant. I mean, Mo, you've touched on a number of resources and support out there for people, but I know you've been working on the Heads Up campaign. Could you tell us a bit more about that? Yeah,
absolutely. I mean, I think what's really great is to talk about the different resources we've got. And I'll talk about the Heads Up campaign and how that works, because it's targeted at men particularly, and it's called Heads Up, Heads Together. It's Prince William's mental health initiative. And what we've been trying to do is remember that we are, as men, not most forthcoming. We're not people who want to talk about mental health. But actually, what you've seen from the campaign is the advocacy of leading figures. You know, some of the top football players, football managers in the country, top CEOs, business people who've achieved great things, but who were saying, well, actually, you know, I've suffered with mental health, or I'm still suffering with mental health. I'm still being treated. I'm having support. But you know what? Look what I've achieved. Look what I can achieve, and look how important it is that I dealt with this mental health area so I could get to where I wanted to be. So what we've done is we've partnered up with Crisis, which is a free text line. And of course, we're all on our phones, we're mostly texting. And they've got a lovely number, 85258. It's a free 24/7 service. All you do is text them saying, I need some help, I'm not coping. Anonymously, they will respond to you, they will talk you through it, they will message you, respond to your messages. So you can really talk about whatever you feel. And how you're suffering and what's going on in your mind. And sometimes we think, you know, I need to only talk about feeling low, or I need to feel about anxious or sleep, or there's something not quite right. It doesn't matter what you're feeling or what you think you need to say to them. Just tell them. They're happy to hear, and they're here as a sounding board. And the great thing is it's free and anonymous, of course, and it's texting, so you don't have to call, you don't have to show your face. There is, of course, another really great resource which I utilize a lot, which is the Samaritans, and they've got a 24/7 call line, which I really like using, because sometimes we don't want to text. Sometimes we want to pick up the phone to someone anonymously and say, well, look, I'm really struggling at the moment. You know, can I talk to someone? Can I get this off my chest? And sometimes we don't find it easy to talk to our friends and colleagues, even though we've talked about how, you know, it's normal to feel this way and we're all together. Sometimes we just want to speak to someone who's outside of our circle. That's okay as well. The most important thing is to start and have that conversation. So the Samaritans have got a free call line as well, 24/7 access. So you've got the text or the call, and they're really great resources. But of course, there are so many other resources that I want to talk about as well. I mean, there's two elements. We talked about how we can support others. We talked about asking twice, and we talked about not worrying about diagnosing the problem, but actually just reaching out and realizing something's not right and helping that other person to communicate that. But of course, how can we help ourselves? And I think the first part of that is, if you're listening to this and some of it's resonated and you're worried or thinking that perhaps I'm in this situation, just take a pause and ask yourself, am I okay? Am I struggling? Are there things that are different today? Has my sleep changed? Has my mood changed? Or am I more irritable? Men often don't say they're feeling low, but they say I'm more irritable. Or my concentration isn't what it once was. Or I used to really enjoy doing this activity or that activity. I don't really find enjoyment in it. If any of those things resonate, perhaps you are struggling with mental health at the moment. And I think that's when we come in and we say, look, we are here for you all the time. Your primary care, your GP is keen and absolutely ready to talk about your mental health whenever you want to talk about it. And again, you don't have to be the diagnoser. You don't have to have all the answers. All you have to say is, I think something's not quite right. I think this is a bit strange. This isn't me. I don't feel normal. I don't feel myself. And there are so many things we can do from there. First of all, we can just be there as a sounding board. We can talk about it. We can discuss it. Perhaps if there is a crossover and we think there may be a physical element, we'll do some investigations, or we may do some blood tests. If it turns out to be that we think it's more mental, we'll discuss that with you. We'll provide ourselves as a resource to check in regularly. Of course, there's free talking therapy. Wherever you are in the country, if you type in Let's Talk Therapy, it's a free online resource. You can self-refer, so you type in how you're feeling, how your mood is, and there's a few questions that direct you, and you just need to say whatever is in your heart, and a therapist will come in and call you, normally within 7 to 10 days, and have a discussion and talk about how they can help and set up some sessions for you. If, of course, you say, well, you know, things are more serious, I think that actually my mood is much lower and this is really impacting my life, then, you know, we may think about medication. And of course, your GP is not going to bring you in and say, right, here you are, you have to have medication, this is what's happening. We have a discussion, we talk about the options, and ultimately we leave the option with you about whether you want to have medication. And as I've talked about previously, and I would just very quickly address that, the medication is there to support you. It's there to help you get back to a level of functioning that's normal. And then often we come off the medication. It's not addictive. It's not going to turn you into a zombie. All of these things are not true. And people have real amazing success stories with it. So I've seen personally. So those are the elements. And then, of course, if it is more serious, if it's something that actually suggests that there are elements that we need more help, we will talk to you as patients, say, well, you know, I think this is a little bit out of my expertise. I think it might be worth us getting psychiatry involved. I think it might be worth us speaking to the secondary care colleagues. And of course, that doesn't mean that you're going to be sectioned or put in hospital or anything. It means that we want to give you the absolute best resource and help we can. And the secondary care team have got a whole huge team that can really support you with different elements. And we think that this would be something that will be beneficial for you. Of course, we may ask and suggest some self-help things. Often, you know, because as we've discussed, as Karol mentioned, it's a normal reaction to an abnormal situation, but it's an abnormal situation that's affected all of us. So we may say, well, actually, here's some areas of self-help that you can do yourself. So there's some really great charities that I always advocate. There's mind.org.uk and there's mentalhealth.org.uk that have a fantastic plethora of resources of self-help. And within that, there's things like how our diet can help, how low-level movement, so walking a bit or just getting our bodies moving and pumping that circulation a little bit can help, how journaling or practicing gratitude or innovative techniques like tapping or mindfulness can really help us, and things that we can take into our life, be in control of, do ourselves, and actually really, really benefit our mental health. So there's a lot of amazing resources available. And of course, the most important thing is to say they're all free, they're all accessible, and you just need to reach out for them.
That's really great. Summary of the resources that we can use. What I wanted to add to it as well is that across the Southeast region now we also have the mental health well-being hubs established as well. So some people perhaps may not necessarily want to talk to the GP about their struggle. The NHS and social care staff can also access some psychological support via those health and well-being hubs as well.
And I think those are really powerful, because one of the things we find is we live busy schedules. We've got kids, we've got family. It's sometimes hard to access your GP or get the phone when they've called or have the meeting. Well, actually, when you're going to work, in your hospital, in your trust, we've got these amazing mental health hubs. They're free, they're a free drop-in service, no judgment, no worries. Come and seek that help at the time you're at work, in your break or during or come a little bit earlier and pop in and get the help. So if you are thinking that actually, I want to get the help, but I'm finding it hard because of my schedule, we have these amazing mental health hubs that are really powerful.
Great. Mo, before we slowly wrap up, I guess pre-pandemic we all had our social life, our coping strategies, going to the gyms, maybe playing football or whatever that may be. Of course, the pandemic has changed that greatly. What would you say? What sort of positive coping strategies should we be engaging with, and what potentially may be helpful for us to support our mental health?
Well, I think a lot of this comes to an individual level. I think we have to recognize that we all have different lives. We all have different challenges going on. I think one of the most powerful things I have talked about, and I found in my own self as well, and my inner circle, my patients who I work with, is taking back control. One of the things we've realized in this pandemic, and has been the biggest stressor, I would say, is uncertainty. Coping with the uncertainty. We don't know if there's going to be another lockdown. We don't know when we're going to be able to go on holiday. We don't know where we're going to be able to go on holiday. We don't know if schools are suddenly going to go into lockdown, if work is going to change. We assume, we hope, but we can see that it's a very challenging time for everyone who's making those decisions. What we do know is that despite all of the external uncertainty, what we can do is we can take back control of our situation. We can say, well, I know that I don't know what's happening outside, but I know what my day is going to look like. I know I'm going to wake up at this time, and I'm going to make a routine that says I'm going to do this, and I'm going to do my work for this period of time, and I'm going to look after my kids, and I'm going to do a bit of walking. I'm going to do these things. And suddenly, we have this amazing sense of achievement. We have this sense that I'm in control. I'm back in control. I can do things again. And it might not be the things I was doing previously. It might not be necessarily going to the gym or going out for big meals or parties, but actually it might be things that I find I still enjoy, I still want to do, and I'm doing them back on my terms. And I think one of the best things we can do is live our life back on our terms. It's one of the most positive ways we can cope with things. I do think, of course, within that, there are elements of things we can integrate. So if you are looking and saying, well, I'm gonna make a schedule, and I'm gonna look at that schedule, I'm gonna do this every day, because when you tick off, woke up and had a morning walk, woke up and did my admin, spent an hour thinking about my family, spent half an hour on the calls to friends, catching up. One, you get a sense of achievement. You feel like I've done something with my day, because often it feels that the days are dragging on. And the second thing is, we are building in things that are really beneficial to us and making sure we're doing them. So I always talk about movement, because I think sometimes we get scared about exercise and running, and I understand that. But, sometimes if I think about running, it could be very worrying. But I suddenly think there's some really great resources from the NHS on, say, Couch to 5K, or the Better Health campaign that talks about how we can improve our health. But just some low-level walking is so powerful. We've seen that the result of of walking, of getting fresh air, of seeing nature, improves what we call endorphins, our happy hormones. That makes us feel much more positive going through the day and through the weeks, and slowly increases how we feel. It also improves our blood circulation. So we pump around the happy hormones through us. We feel more energized. We feel more awake. And of course, there are other things we can build in. So things like journaling, writing down and documenting what we've been doing that day. At the end of the day, specifically building in 20 minutes, half an hour, even 5 minutes. If you're just so busy, then you just take a piece of paper and you just write. Don't worry about the handwriting. Don't worry about it making sense. Write down how you're feeling. Write down what happened in the day. Write down how that impacted you. The research shows that it is one of the most beneficial things you can do, because it allows you to express your feelings. It allows you to consolidate the day, and it improves, again, all of those happy hormones. Of course, there are other things that are really beneficial. So practicing gratitude and being thankful for what you have. We appreciate it's a really challenging time, but we can all find elements of things in our life that we're thankful for. You know, perhaps it could be something as simple, but we forget, as just having a place to live, having food on the table. That sort of thing is something that when you take a moment, we find that practicing that gives us some context and gives us some peace and happiness. And of course, the final thing I think that's really great and plays into the whole community aspect is helping other people, being there for other people. The number one evidence-based thing that we can do that shows a massive improvement in our mood is being there for other people, helping other people. And it sounds very strange. You think, well, gosh, I'm suffering quite a bit. I'm finding it quite tough. But when we call someone and we say, look, I was thinking of you. You know, how are you doing? How are you? Or, you know, I'm popping to the shops. Can I get you some milk? Can I get something for you? Practicing that help of other people is something that makes us feel better. It makes us feel worthwhile. And also, the evidence shows it makes a huge impact on our mood. It makes us feel part of the community. It makes us feel happy in ourselves. So I think starting to practice that is a really, really powerful thing. So there's a few things in there. And of course, some of the resources I've mentioned earlier have got other really good concepts. But I think taking back that control and doing things that we wanted to is a really, really powerful way.
I think that was brilliant. And Mo, I think what I'm taking away from this, not being a man, is the fact that it's okay to have these issues and feel that something's not right. And you know, there are help out there. So try and get that help, no judgment. And I think you really conveyed that message so clearly, which is fantastic. And the levers to try and reduce stigma, I just think it's fantastic. So thank you for that.
Yeah, I completely agree. I think the key message that we want to give is to say that if you're somebody who's watching this, if you're a male and you understand all of what we've said, you know better than us your situation at home, your personal circumstances, you know better than us all the things you've been through in your life. But you also know that we can't survive without our brain. Our brain is our organ. It does everything for us. It's our executive. We have to look after it. And if you're feeling something's not right, if you're a friend of someone who you're worried about, if you're a family member, then the only thing that we want you to do is reach out. Reach out to any of the self-help techniques we talked about. Reach out to some of the free contacts on texting or phoning. Reach out to your GP. Reach out to a friend. Start that conversation, because when you start that conversation, everything will come from that, and you will start the process of rehabilitating your mental health and starting to get through this challenging time.
That's fantastic, Mo. Thank you so much for your time today. I think it's been fantastic. Karol, did you want to add?
No, that's a really great actually way of thinking about you know what sort of issues men may face, how to address them, you know, what sources of support there are. You were also earlier talking, well, as you were talking, I was thinking there's almost like three domains around achievement, closeness to others, and pleasure, or finding some of those pleasurable activities that may be super helpful. So from my side, thank you so much. That it was a very, very rich conversation, and we talked and touched on so many different topics. And I hope that this is going to be very helpful to think to help us to think about how to navigate those issues surrounding men's mental health. So thank you so much, Mo, for your time.
Thank you so much, Mo. That's brilliant.
Thank you for having me.
That was fantastic. No joke.